Coming at you live from Toronto, here are your hosts, Jackie and Jetty.
Hi everyone. Hello. Welcome to the show, the Hygiene Corner. I'm your host, Jenny, and this is Jack. Here on today's show is Ashley, Monica, and Jung, who are dental hygienists, and they are going to be telling us all about a universal curette called the Columbia. And later on, Jung will be giving a demonstration. Welcome to the show, Ashley and Monica. Let's hear it for Ashley and Monica.
Thank you so much, guys. Thank you for having us.
Thanks for having us. So, what do you have for us today?
Well, I just want to start off by saying thank you for having us today on the show. And basically, we're just going to be talking briefly about the Columbia. So the Columbia is actually a universal curette. And what it is it covers all the surfaces in the mouth, but we're just going to be focusing on the main posterior region for today.
Now the audience is dying to know, can you go subgingivally with this instrument?
Yes, you can actually. The Columbia is used primarily for subgingival areas, although it can be used supragingivally as well.
That's awesome. What kind of calculus deposit can it remove?
It actually removes medium to heavy calculus deposits, making it an actually very rigid instrument to use.
Now the Columbia looks a lot like the Barnhart. Is there any differences?
Yes, there is actually. The Columbia has a shorter terminal shank compared to the Barnhart.
That's amazing. Actually, can the cameraman, can you get a shot of the instrument? I want to make sure that everyone can see it clearly.
So as you can see here, there are two cutting edges, the short terminal shank, and the relationship between the face and the lower shank makes a 90-degree angle.
And it's a double-ended instrument paired with mirror image working ends, a rounded toe, and a semicircular cross-section as well.
Now, is this a self-angulated or non-self-angulated instrument?
It's actually non-self-angulated just because it's already at a 90-degree angle, but if you tilt it towards the tooth, it actually makes it a 70 to 80-degree angle, makes it easier for us to debride.
Okay, that's great. Okay, actually, we're going to have to stop here, girls. I know we're having so much fun, but we have to go to a quick commercial break, and we'll be right back to you.
Okay.
Triumph over tooth decay. Procter & Gamble announces Crest toothpaste with Fluoristan, its exclusive fluoride compound, world's greatest weapon against decay. Crest brings your family the blessing of healthy teeth, strengthens tooth enamel to lock out decay from within. Triumph over tooth decay with Crest.
Okay, so welcome back, and we are here with Jung to show everyone how a Columbia scaler is used in the posterior region. First off, we all know that the Columbia is a universal scaler, which means it can be used anywhere in the oral cavity. But as we practice as dental hygienists, we find that this instrument is more convenient to use in the posterior region subgingivally. We will now show you a brief demonstration on how this instrument is properly used. Okay, so we're going to be working on area 4-6 to 4-4 buccal, and Jung Hae is going to take the instrument and she's going to apply it at the distal line angle. So you want to make sure that the tip third is on the tooth and not the whole side of it. So she's going to adapt it. What she's doing right now, she's going to close her instrument, she's going to insert and activate. So she's going to make sure she's going right into the distal contact. Once she finished doing that, she's going to start at the distal line angle again, and she's going to debride all the way through the facial surfaces and work to the mesial contact. So she's going to adapt, close, insert open, and activate. And she's going to do the following steps through teeth number 4-5 to 4-4 buccal. So as you can see, we're following the exact same steps. And you're always making sure you're using a proper fulcrum and you're doing accurate pelvium motion, and you're going to make sure that your terminal shank is always parallel to the tooth for making sure that you're using the right working end. Okay, perfect. So thank you so much for watching, and that's our demonstration of the Columbia.
Thank you.
We hope today's show was very informative. Thanks to our guests. We'll see you next time on the Hygiene Corner.
Great, and make sure to join us next week when we talk about toothpaste. Now, does it really prevent cavities? We don't know. We'll find out.
Sexy thing, you. I believe in miracles. Since you came along, you sexy thing.
Welcome to our show at the Hygiene Corner. We're your hosts. I'm Jenny, and this is Jackie. So this is the.
Just go with it.
Thank you for coming to the show. So Monica, where in the mouth can we use the? No, see, stupid again.
Okay, it's okay.
Because it doesn't make sense.
Welcome to the show, Ashley and Monica.
Give it up.
What's? It's loading.
So we hope today's show is informative. Thanks to our guests from
We don't know. We'll find out.
Keep calm and scale.
What happened? What happened?
We hope you didn't.
We hope you didn't enjoy the fucking show because we suck.
Okay, one.
Do it again.
Okay.
Guys, we worked so hard on this project. I think that we should let loose and have some fun.
Yeah, you're right. I really think we should.
Okay.
Guys, we worked so hard on that project. I feel like we should let loose and have some fun.
Yeah, you're right. We really should.
This car could be systematic, hydromatic, ultramatic. Why couldn't we grease lightning? It's a keep talking. Fuel injection, cut off the cool, and it's not to you. We are ready. We can force me on the floor, never waiting at the door. You know that ain't shit with a grease lightning.